Good afternoon. Welcome. Thank you so much. What a great response that we have coming out. I am Paul Formica. I'm the first selectman of the town of East Lyme. I've been a resident here since the early 1980s, and we have decided that it might make some good sense to talk about a problem that doesn't seem to get enough conversation in our community and communities throughout the state. I happen to be serving on a newly created task force by the Connecticut Conference of Municipalities, where we're talking about the same thing. But town mayors and first selectmen and other community leaders are getting together to talk about how it impacts towns like Ridgefield, cities like Bridgeport, all the way out to towns like East Lyme. And we had the opportunity at our first meeting to have the commissioner from Demas to come out, and I've forgotten her name, which is Pat Reamer, who was out and gave some very detailed presentation about what the state is doing and what we're talking about, and that is the problem about heroin addiction. And that heroin addiction is not just confined to the poor, poverty, to cities. It is a problem that is in all of our cities and towns. It's in all of our households. It's going to touch all of us at one point or another, and it's just time to talk about it. And it's time to talk about what we can do, one, to raise awareness, and two, to collaboratively work together and find solutions. I liken it to when we have our friends from Ledgelight Health District here today, and many participants, and I'd like perhaps those of you who want to introduce yourself to do so as we get started. But there's two things. One, there are some people here that may not want their name or may not want to be on tape. We do have CBS here. I have a podium up here. If you want to come and share, you have to speak in the microphone because Carmen is taping this. We're not going live, but we do have it on a CD that we hope to play to the community on our cable access channel. And for that reason, we want to be able to get this out to a broader community and broader vision. Is that okay with everybody? Does anybody mind that? If you don't want to identify yourself or you don't want to tell anybody why you're here, then that's fine. That's not something that we need to talk about. We do have a lot of agencies and community organizations here, and I started to say that when Ledgelight told us some years ago, you'll probably all remember this, we have a swine flu epidemic, and we had to do something about it. And what happened? Everybody rallied around. All kinds of agencies, all kinds of people. We had vaccinations, we had awareness, we had conversations, we had spotlight on what's going to happen. We had education with our kids, we had education with our elderly. Here we have a silent epidemic, an epidemic that is occurring right under our noses, an epidemic that because of its very nature, people don't want to talk about. So in the meantime, we've had 2 overdose deaths this year in the town of East Lyme. I know my friend in Litchfield is overseeing, the first selectman is overseeing there, where they also had 2. That's unheard of for small towns like this. We've also had probably a dozen or more ODs that did not end up in death. And we're going to talk a little bit about why we were able to save some of those folks. But the fact of the matter is ODs are occurring, and we have to do something about it, and we're here. We're lucky enough, as I mentioned, the state commissioner was at our CCM meeting. We have the regional manager, Rhonda Kincaid, is here from DEMAS, which is the Department of, what's the official title? Mental Health and Addiction Services. There's a short video that we're gonna see that she brought. I'd love to have her come up and talk in a few minutes. But what I really want to do is to have this to be an interactive conversation. This is not Formica up here talking about this problem because I don't know anything about talking about this problem. I just know that as first selectman, my deputy first selectman, Mark Nickerson, and all of the members of boards and commissions in this town, we have the assistant superintendent of schools here today, we have the principal of the high school. Our jobs are to promote the health and safety and welfare of our kids and of our community. And that's why I think that this is an important opportunity to get the information out. So what is the problem? I'm going to kind of outline what I think the problem is, and the problem is clearly it ends up to be heroin addiction because of its economics. But how does it start? And what are some of the things that we can do to combat it and that we want to talk about in a broader sense today? prescription drugs tend to be the overriding beginner or the gateway to this problem this time, this day and age. Back perhaps when I was in high school, it might have been something different. But people are getting addicted to prescription drugs, and there's a variety of reasons. Either they're housewives that are home all day, maybe they're people who have had some kind of procedure that causes pain that they become too accustomed to taking these things and they become more addicted. Maybe it's kids or people that find these prescriptions in their household medicine cabinets, and then they begin taking those, and one thing leads to another, and prescription drug is much more expensive on the black market to sustain a habit, and then the switch is to heroin. So what are we going to talk about? We should talk about doctors. Is there overprescription, or what can we do to bring that to light? And there are some other programs that, again, we can talk about that community is taking to try to take some positive steps to that. So with that, instead of having me just stand up here and discuss, I placed a microphone up there for us to tape it. We need you to speak into it. But if you would like to share some things and talk about why you're here, I'd love to hear some of the reasons that all of you showed up. Is that fair enough? Anybody? Dave, thank you. Dave Putnam is our Park and Rec Director. He's been a key leader in our fight to bring awareness to substance abuse over the last many years.
Great. Thank you. Like Paul said, my name is Dave Putnam. I'm the Parks and Recreation and the Youth Services Director in town. The reason I'm here is basically why everybody else is here, to gain information and also for myself to get better informed on what's going on in our community and region-wide, so that us at Youth Services or Park and Rec can identify some of the issues that might be coming down the road for us. Just an initiative that we have had in the past, we've had an ASAP coalition, which was our prevention coalition in town, and for staffing reasons and for other purposes, it hasn't met recently. So what I would like to do is, starting in September, we're going to start with our new coalition. We're going to call it the East Lyme Youth Coalition, and just keep it very simple and plain, and start this discussion again within our community. And unfortunately, the discussion with ASAP and our coalition, our youth coalition, kind of fell apart there for a while. I think it's important that we bring it back, and we're going to start it with a new name and a fresh look. And so look for us in September to start with the East Lyme Youth Coalition and start moving these things forward, getting people in the community educated, and not only this area in the heroin area, but also teen alcohol use, prescription drug use, any of those things, kinds of lines. So that's why I'm here today, and hopefully everybody will come up and speak. So thank you.
Anybody else like to come up and share why we're here today, or what they see, as a piece of this puzzle? Yes.
I'm Doreen Arnold, and I'm just a concerned resident. Excuse me, I'm a retired neonatal nurse, and we get the drug babies in the NICU is where I work. And we used to get them in years ago. It was just methadone. Now the ones we're getting in, the mothers are all addicted to heroin and going on to methadone. And to see these babies go through withdrawal, and the women that we're seeing are not your stereotypical that you would see years ago. And people would say, oh, they must be black, they must be Puerto Rican. These are nice white girls, and coming from nice towns, nice families, and they're hooked. They're hooked on heroin. And as a resident, I'd like to know what you can do to help them.
Perfect. Anybody else like to make a comment? Mike?
Good afternoon. My name is Mike Susie. I'm the principal of East Lyme High School. I'd like to thank Paul for this opportunity to bring us all together to try and work on this problem. I know I can speak for the high school and the teachers at the high school. We are seeing a rise in this issue, and we need help. We need to get a better understanding of what we're dealing with. We need to collaborate more with the town and the resources that are out there. and try and help support the students. That's why we're here. Thank you.
Thank you. That interest is kind of the reason why we have one of the greatest school districts in the state. But we're not alone.
I'm an elementary principal, and I'm here not because I'm worried that the children at that age would be involved with heroin, but I am worried about their siblings, and possibly their parents or family members, older friends that could be. So I just want more information.
Thank you. One of the things that we have here in the town of East Lyme is the DARE program, and the DARE program is an awareness program, like there are many others. It doesn't have to be DARE, but our East Lyme Police Department is overseen by our resident trooper sergeant Bill Blanchette, who just came into the room and has been. He came and attended the CCM task force meeting with me, along with some of his fellow Connecticut State Police members of major crime and other. I think the colonel was there as well, talking about the efforts that the Connecticut State Police is trying to do to bring awareness to this problem. So I appreciate Bill here. With him is Lindsay Cotillo, who is has our drug dog. What's our drug dog's name? Knox. Knox is with her all the time. It came by a grant from some interested community members, and Lindsay has turned out, since the advent of her or the expansion of her department, to be one of our busiest officers, because we have so much work that we have to do. And I'm sorry, I don't know. My son. That's why I didn't know him. Last time I saw you, you were half a foot shorter than that. That's why I didn't know who you were. So that's why they're here. But I talked about the DARE program. And the DARE program is great because in the 5th grade it does a couple of things. It introduces this problem to the kids that they may be facing in the next few years, identifies what kind of drug may be seen to them, recreational and certainly the opportunity to abuse. But it also brings the police community to the kids as in a different light, not as somebody that they're afraid of, but somebody that they can trust. One of the things that I would like to see, certainly in this community, is that the DARE program works very well in 5th grade, but we stop there. I think we need to get something in the 7th grade when they begin to start seeing these things, start experimenting with these things, start actually physically holding and touching these things, and succumbing to peer pressure. And then another program that we may want in 9th or 10th grade, when in fact some kids are in need of recovery by that point in time. So I think that that's one thing that I'm going to try to do and try to push forward, is to expand that program again, be it DARE or be it some other program, perhaps a park and rec, perhaps something that we can talk about to do that. But anyway, I thought about that when I mentioned Bill's name. Anybody else like to get up and say anything or mention anything as to why they're here? Thank you. I'm sorry, we looked for a handheld microphone, but it was cut out of the budget this year, so we can't pass that around.
Hi, my name is Michelle Hamilton. I'm with Ledgelight Health District. Just want to share with you a couple of things that we've been doing in your community. We've been working on prescription drug abuse prevention, and like Paul said, one of the things that we see is that's the start of the downtrend towards heroin. So some of the things that we've been doing right here in East Lyme with Lunch and Learns, we've been going to doctors' offices and we're talking about prescribing guidelines. I think that's a really important thing for us to be talking about. If you look at the 3 common drugs that they're being abused, it's the oxycodone, it's the Adderall, those type of drugs that are being abused. And so when we go and talk with the doctors, the physicians, that's one of the things that we talk about, looking for signs for abuse, and talking about the New York City Department of Public Health, who has come down with some guidelines for prescribing. So when you're prescribing an oxycodone, make sure it's a lower dose, a shorter course, because a prescription you can become addicted in a really short course from these drugs. So we've been talking to doctors. We've been doing a Bust the Myth campaign, which we talked to senior girl classes at the high school in East Lyme. We did a short survey of how many kids in that class had taken a prescription that wasn't prescribed to them, and it matched the national statistics of 1 in 4. they were taking oxycodone, they were taking an Adderall. So we were talking about with them, don't use a prescription that doesn't belong to you. And then we also had a drug summit here at L&M at the hospital. We had physicians come and speak about the prescription drug monitoring program, which is now something that all the doctors have to register for, encouraging them to utilize it so that they can make sure that what they're prescribing and what maybe other doctors are prescribing that they go see, prevent doctor shopping. So those are some of the things that we have been doing. I am open to other ideas because the next step, once you are addicted, would be heroin. It's a lot cheaper than a prescription. So I'm looking forward to hearing more and more about what we can do to kind of combat this altogether.
One of the great things about Ledgely Health District is that they are a regional health district, and I believe we have 6 towns that are involved in the regional health district, and it allows towns like East Lyme and Ledyard, of which that I can think off the top of my head are involved, is to get expanded into some of these health situations that we normally wouldn't have been able to do with a single sanitarian or a local office here. So, and I know Ledgely has been very receptive to a lot of these things, and they have, you want to talk about this too, this is a program you have going on, which we'll talk about, we'll pass out that, it's about the 7 great myths about marijuana, and that is a program coming up June 17th in the morning at Connecticut College, so we have some of that. And I have some literature here. We also have some action councils throughout the state. There's probably a dozen or so. Michelle is here from our regional action council. I don't know if you wanted to say anything, what you're here for, and it's nice that you're in the room. You've worked with the town for a long time in the past, and we appreciate that partnership. So.
My name is Michelle Devine. I'm the director of the Southeastern Regional Action Council. We are the prevention, intervention facility or agency for Southeastern Connecticut. So we have 20 towns that we cover for Southeastern Connecticut. We are funded by state and federal grants and from DMIS, Department of Mental Health and Addiction Services. We receive funding. We also receive funding right now from Purdue Pharma. They are the makers of OxyContin. They are providing us some funds to do some prevention efforts, to make people aware around the risk of misusing. With those funds, we have brochures going home, or will be going home once school starts again in September to all of the students. But it's actually geared towards their parents and locking up medications in their homes, making sure that if they have medications, it goes into a lockbox, and that the students or kids or even their friends, not necessarily their own friends, don't have access to it. We also are working with all of the realtors in the region. People are no longer just going to open houses for open houses. They're going to take prescriptions out of the bathrooms or out of the cabinets. So we are working with all of the local realtors to educate them on, for someone that is selling their home to lock up all of their medications. With that, we're also you'll be seeing soon an insert in the papers, just a brochure, again, how to properly dispose of unused medication. I know that you all have a safe disposal box or prescription drop box at the police station, so anything you're done with, you no longer need, please drop that off at your police station so that it's not in the home where, again, people could get access to it. So that's, in addition, we've done a regional heroin forum similar to this. We had many people from around the region coming, other first selectmen, mayors, and school personnel talking about this same issue. And we received a lot of very good information, what people are looking for, again, just education awareness for those that don't know much about this, and then what are some strategies that we can use at different levels in the community. But it is something that we do the school survey in many of the regions. You've heard about that, I'm sure, read in the paper about all of the different school surveys. East Lyme did one a few years back. But that information that we gather from all of the students in the region is very valuable. No town is different from any other town, really. They're all very similar, so our regional statistics are, pretty much accurate for what's happening in your town as well as the region. But it helps us to identify what we need to do next and where we need to go next with some of our funding. It is something that, we definitely have been talking about for a while, but it's now right there and right at everyone's doorstep, and it's affecting more of us. And so between the work that we're doing with Legislate and the school systems and the town, and hopefully there's always more work than we can do, but we are hitting a lot of the different areas. And we always need more hands and we need more support, and it's always one step ahead of us. But we are hitting a lot of areas. You might not realize it, but please reach out to any of us, and we can, always take extra hands to do more. So thank you.
Michelle, is there a website that people can access that might have information from your group, or no?
Not from my group. No.
Not from your group. Okay. All right. I didn't see one. I just wanted to ask and make sure. We talked about the drop box, and it surprised me. We have one here at the police station for any of the excess drugs or outdated, expired drugs. Bill, how many pounds did we collect?
We collected over 500 pounds during last year alone. Much of the stuff that we got was medication from people that passed on. But as everybody's been saying, it's, this is how it starts, whether it's somebody going in for an open house or somebody going into grandma or grandpa's medicine cabinet. They get prescribed these medications, which unfortunately sometimes is short term. They become addicted to them. They need other avenues to get those medications, and either they start, stealing medication, which is very expensive, stealing to purchase that medication.
Bill, we can't, I need you on the microphone. If you're going to, maybe I'd have you repeat some of that. But to me, that's a huge amount, 500 pounds. And here we are just in East Lyme alone. So if you can imagine the nationwide, statewide, countywide problem. Thank you. I'm sorry.
No, that's all right. Like I was saying, it's the amount of medication that we're taking back from just this small community is it's absolutely incredible. And I know people discussed it. I apologize. I was a little late getting here. We're actually in the process of hiring a new officer so we can continue our fight on this drug. Officer Cotillo has done a wonderful job with the interdiction and seizure of a lot of these drugs that are going around. And as I said, it may start very innocently. Somebody injures themselves, they get a prescription, the prescription runs out. Unfortunately, they become in an addicted state and really will get terribly sick if they don't have this. And if you've never seen anybody that's dope sick, it's really not a pleasant thing. So it really, truly is a horrible addiction. Unfortunately, the heroin is considerably cheaper to purchase than prescription drugs. But when they're getting heroin, they're getting very, very potent heroin. We've had 2 deaths this year so far in East Lyme. I'm sure our emergency medical personnel can tell us that they're responding at least once every other week to an overdose. We're doing what we can. Certainly we can do more, and we need to do more. Just the fact that the community has rallied together like this shows what support that we have, and we, the police, certainly appreciate that. I know Mr. Formica has been doing a lot of work to combat this problem in this area. The drug drop box, I think, is a wonderful thing. If you have prescriptions that are no longer being used, we'd certainly ask you Monday through Friday, bring them down, drop them off. Like I said, we've taken over 500 pounds of narcotics back up to the state toxicology lab where they're destroyed, not harming the environment. They're destroyed in the best way possible. They're off the streets. We don't have to worry about them. One of the other things, I know Mr. Putnam with Parks and Rec has been working a lot with the at-risk youth. We just had 4 of our officers go with Parks and Rec. And how many kids? 22 kids. They went to an adventure outing, and it's trying to get the youth more involved with the police more involved with the youth. The officers did it on their own time. I think it was a great success. As Mr. Formica says, it gets the kids used to being around the police officers, that they're not afraid, they're not nervous being around the police officers, and it really creates a great rapport with the kids. We need to continue to do that, to let the kids know that there's other resources available. I know Ledgelight has been doing a wonderful job doing the stuff that they do, but I would suggest that, again, that drug drop box, if there's anything that needs to be disposed of, please let everybody in town know that it's at the police department, and we will certainly accept everything and anything other than cancer drugs, anything that's the radioactive stuff.
I have one question. I called the town garage or wherever they connect you with the dump, because I had old prescriptions to get rid of.
Okay.
And whoever I spoke with was not aware of that.
All right.
They told me to just dispose of them. They said put them in a coffee can with 12 rounds, but just throw them out.
Okay.
So you might want to just make sure that everybody's
All
aware
right.
of that.
Yeah, we've told all the pharmacies in town.
Yeah.
I know the pharmacies have been advising people that we do have that container available, but that's something that we could certainly get out a little bit better. So, thank you.
Another women that I see in the hospital, they say that heroin's cheap. How much is it?
Well, you can get a bundle, which is 10 bags for about $40. Used to be, well, Lindsay, you arrested a young man the other day stealing. He was doing 4 to 8 bundles a day. So that's, 8 bundles, that's 80 injections a day. So, and it's just, it's a constant thing. There's some people that you wouldn't know that, are contributing members of society that are using 5, 6, 7 bags a day just to get by, and you'd never know it. Then they're the people that, with the track marks that are using, 400 to 800
And
packs a day.
they're not only injecting it now,
They're not only, they're
there's-
smoking it,
There's other ways now, and that's evolved in how they take it, so that it's not quite as obvious. And thank you,
Yes,
thank
sir.
you very much. You want to have a question for the sergeant? I was going to.
Just one thought, because I know at Connecticut College had a forum on drugs as well last year. And the one thing I have noticed, there was promotion about drug use, but nobody really emphasizes the effects on people when they take these drugs, what it's doing to the body, it's killing them.
that's
And I think
correct.
that's a critical thing to-
So the question was the emphasis on effects. I'm only repeating you because we need to get it in the microphone for the tape, that's all.
That's one of the things that our DARE program teaches, the effects. But it's, again, as Mr. Formica says, we're teaching to 5th grade students now. We need to expand on that and teach to the young adults something, what these effects are. And unfortunately, we're combating urban legends because many kids are going to be saying, well, I've done this before, and it didn't do this to me. But all it takes is one time. You get a hot shot, you get some bad heroin. They had fentanyl-based or laced heroin that was killing people almost immediately upon injection.
So,
So it's, there's, with the marijuana, it's now technically non-criminal for possession less than 4 ounces. We did a spot check the other night on 156. First time I've seen it. I've been a cop for 26 years. Lindsay, what's it called? Dabs?
Dabs, the wax.
It's a THC-based wax. It's almost 100% THC. It's pure marijuana in a wax form. They have marijuana candy. There's all these ways that people are ingesting these drugs now. And say what you want about marijuana, if you agree with it, if you don't agree with it, there's not a question that it's become a gateway drug. People are using this stuff. They're using it in higher frequencies because it's non-criminal now. They're making it into, like I said, the candy, the wax.